Next speaker is Dr. Nikhil Datar, gynecologist and health activist and founder president of the Patient Safety Alliance. Please welcome on stage Dr. Nikhil Datar.
First of all, thank you very much for this opportunity that you all have given me. When the organizers told me that I'm supposed to speak on innovation in healthcare, I said, well, I have not done any innovation, really speaking. Went home, thought about it, and I realized, yes, of course, I have done a different kind of an innovation, probably. And I must acknowledge the fact that with me, there have been a number of other people from this society. Few of them are in this particular audience. And we have all actually speaking got together and thus this kind of an innovation. When we talk of healthcare, as far as India is concerned, everybody talks of access, cost, but nobody really talks of quality. Nobody really talks of transparency. Nobody really talks of safety. When there is enough of material available in the world, which says that 10% of the people who go to the hospital or to a healthcare sector get harmed rather than getting treated, and when the whole of the world is aware of this particular fact, that in developing countries, this magnitude may be 20 times higher than what it is in the developed countries, and when WHO says that 7th common cause because of which people in this world die is because of unintended medical errors, I realized, well, are we doing anything about this? I am a professional gynecologist, so typically the most sued community amongst doctors. I am a patient as well. So on one hand, I am aware of the fact that, well, I am into a risky business, and with my patients, I am into a risky and unknown territory. On the other hand, when I become a patient, I want a very, very safe healthcare. So it's not enough, really speaking, to point fingers, but need to think much higher on a much different pedestal. And that's exactly what we did together by starting an NGO called as Patient Safety Alliance. We empower patients through education as well as we support healthcare professionals to reduce the medical errors. That's the work that we do. When we talked of empowerment, we realized that if we want to make a change in this particular country's scenario, then the driving force has to be the consumers. And consumer means you, me, everybody. What we did was we put together a seminar called as Be Alert Seminar, which is for health consumers. We created some very Indian films around this particular topic. Some of those films are onto YouTube. Medication Error is a film which is there onto the YouTube. I think you will be surprised to know that probably on the YouTube, this Medication Error is the only Indian film in Hindi that is available across the world. Likewise, we created a number of resources. We created some kinds of checklists, some kinds of paper tools that patients could use and help themselves as well as their doctors to achieve safe medical services and safe healthcare services. We created this kind of a seminar, which we actually speaking do with many of the NGOs, schools, colleges, even many of the corporate sector for their own employees, and actually empower patients with knowledge in terms of what they need to do, what are their rights, what are their responsibilities, how they can help their doctors, how they can use effectively materials like Google, internet to find authentic services, authentic websites, authentic information, up to how they can take a legal recourse if the things go wrong. We also support healthcare professionals, so we created a similar seminar called as Be Alert, Be Safe for the healthcare providers. And we made them aware of the fact that although you have great intentions of treating patients, you unknowingly land up harming patients. So we created some kinds of films again. And one of them is on hand washing, where we are actually causing a behavioral change as far as hand washing techniques are concerned, even amongst doctors and interaction between doctors and patients. Most of the time we find this question that patients say that, well, you talk of hand hygiene, but when the doctor walks in, how do I tell the doctor that you have not cleaned your hands? So we created a small 20-second film which kind of makes doctor aware of the fact, because we say that the relative who is standing next to the patient can simply show the bottle of hand hygiene and give it as a prasad, yeah, and not ask the question whether you have washed hands or no. So these are the simple, small, little things that we actually speaking did. In fact, it is very coincidental that today in the afternoon, we are releasing a small computer application called a Safe Prescription, which helps doctors give prescriptions in error-free manner. So ladies and gentlemen, Now you don't need to depend on the non-dependable handwriting of doctors, yeah, because you will get a typed prescription, and on the top of it, if you don't understand English, I mean, in this audience, everybody would understand English, but if we consider a country like India, then most of the people may not be able to understand English. So those kinds of instructions which are written by doctors as 1 TDS, which means 1 tablet 3 times a day, etc., through this kind of a software application will get converted into any of the Indian languages, and the patient will go home with that particular prescription which has Indian commentary, Indian instructions in Indian language for the patients. We have planned some kind of a judicial activism as well. However, my time is up, so I think I'm not going to hold you back. This is the kind of the innovation that we have kind of created, because we believe that the world is only of patients. There are some of us who for some small part of our life also perform as doctors, but we were patients, we will be patients, and we are patients. So the world is of patients. Let's make world safer for patients. Thank you, ladies and gentlemen.